I'm thinking about the biological part of the model and whether
Mm.
you might be able to say a little bit about how you might think about what's going on in a human who is experiencing, excuse me, a mood disorder, the kind of biological factors that might not be so familiar to colleagues who are not in the medical profession. Could you say a little bit about that, Chi?
Happy to, and by all means, guide me if I'm not addressing the question directly. I think just to take a step back, it's important to highlight the sort of approach we take as psychiatrists. We are medical doctors, and for most medical professions, it's about problem solving. So there is a presenting problem that we're faced with. So it might be somebody coming in with a low mood, not feeling that their energy levels or what they had been in the past, not being able to enjoy life. And so we take a detailed history, which includes getting to the nub of what's been going on psychologically, but also looking for other clues, if you like. So that can come from asking about the family history, and we might look for a family history of any mental health problems. So, in thinking about the biological arm, some conditions do run more commonly in families. So, if there's a family history of depression or anxiety, it may be the case that the individual I'm seeing is more susceptible in the face of further adversity to developing one of those conditions themselves. We would also look at a whole range of things right through their personal development. So again, looking for traumatic events, both physiologically and psychologically. We'd ask about drug and alcohol use. That could be something that's precipitated a mood disorder. It might be perpetuating it as well. And the next step really is to look at the mental state examination. So that's, if you like, the history is the climate, and the mental state examination is the weather. So it's the here and now, what's really going on in the recent past. And by putting those two things together, we can formulate a diagnosis. And then we can start to, as part of our formulation, think about what are the factors that might have caused this particular episode of, say, depression. And so amongst biological factors, I talked about a family history, substance misuse can certainly play a part. So patients, for example, who are alcohol dependent tend to have a higher rate of anxiety and depressive disorders. If somebody has a long-term condition affecting their physical health, something like diabetes, that puts them at increased risk of a mood disorder. So there are lots of little clues that we'd be looking for during our diagnostic interview.